Let us now move on. I'm happy to introduce Sheri Arnott. She is a senior policy advisor with World Vision International. Your organization has experience in many countries. Can you share some key insights on our topic here?
Yes, thanks. Thanks, Regina. Thank you to the previous panelists. My presentation is going to focus specifically on addressing some of the transformative aspects of resilience programming through a local level advocacy approach called Citizen Voice in Action. So we know that effective, representative, and accountable local governance and access to quality services are critical to supporting vulnerable households and communities to build resilience to a range of shocks and stresses. Social accountability mechanisms build more effective and inclusive relationships between citizens and their governments through empowering poor and marginalized households and communities to engage constructively with service providers and governments to improve local service delivery. Citizen Voice in Action, or CVA in World Vision lingo, is our approach to social accountability, and it includes civic education, a community scorecard, a social audit, and facilitating constructive dialogue between communities and their governments. CVA is a key pillar in World Vision's organizational approach to sustaining positive development outcomes for vulnerable women, men, and children, a key objective shared with the resilience community. During this conference, we've heard how important government leadership is in supporting poor households and communities to move out of poverty, weather shocks and stresses, and build more equitable and resilient futures. Emphasis has always also been placed on how building resilience depends on putting the lived experiences, aspirations, and expertise of communities at the center of resilience building efforts. These two perspectives are wholly compatible. In fact, for us, they are two sides of the resilience building coin, so to speak. In fact, our experience is implementing CVA as part of our long-term community development work in over 300 programs in 34 countries. That's not the extent of World Vision's programming, but that's where we're implementing, that's how many programs we're implementing CVA. We have found that CVA brings together communities and government officials and service providers to build greater mutual accountability, trust, and collective problem solving. So what does this mean in the numbers, since we've had a lot of emphasis also on measurement and evaluation during this conference? So independent research using random control trials on the participatory scorecard used in CVA in Ugandan primary schools found an average increase in primary school test scores of 9 percentage points, a 10% increase in pupil attendance, and a 13% reduction in teacher absenteeism at an estimated cost of $1.50 per student. For health services, monitoring of health clinics in 50 communities in Uganda studying the impact of social accountability approaches led to a 33% drop in under 5 mortality, a 20% increase in the use of outpatient health services, and a 58% increase in the number of deliveries by skilled birth attendants. Later in the program, I'll say a little bit something around some of the key process results that we've seen, in particular around collective action and inclusion and the building of social capital. I think what's really important for an organization like World Vision, which has a huge global reach in terms of programming and scale, reach and scale and programming, is that CVA has been helping us to reframe our traditional role in many places as service providers to beneficiaries to one of facilitating direct engagement between citizens and their governments to improve both quality and quantity of essential public services. I'm going to leave it there.